This is Courtney and Dave with Chardon Physical Therapy. Today we are going to talk about concussion. So we're going to create a discussion for parents and athletes so that we can just provide education on what is the process. Because it's something that I was genuinely curious about, especially with what's going on in the NFL and the news. And I think the culture around concussion is just living in that gray area, even though we have processes in place, that we're not just making the best decisions. So, talking about decisions, Courtney, you have 3 kids. Would you send them to me for the initial stages of the concussion?
Not the initial stages, no.
Right. And that's just because of my lack of education in the initial stages. Now, I have 2 kids. I would absolutely send them to you. I'd call you immediately if I knew that there's a possible concussion injury to ask you tons of questions. But let me have you talk about like why I would actually reach out to you. So please share with our audience like what your additional knowledge is.
I took the concussion certification training through Shift Concussion Management. They're up out of Canada, and they work a lot with the NHL players that get concussions.
Very good. So let's start with on the field. So an athlete gets injured, and that's in any sport out there, even non-sport conditions as well. But when there is a possible concussion that's there, what's the first thing that gets done?
The first thing that should be done is the kid should be removed from play immediately and not return to play, even if there's a suspected concussion at all. And then there's a really quick sideline screen that any coach can perform. It's called the SCAT-5, but there's also other modified versions of that as well.
Okay. Can you share with us like what does that look like in case, like as a parent, like what if there wasn't a coach who is knowledgeable in that, or there wasn't an athletic trainer? As a parent, what could I actually do?
Mm-hmm. I like to ask about their symptoms and what they're feeling, if they have any head pain, any dizziness or nausea, and then also you give them a really quick and simple memory test, and it can be giving them 3 silly words and then asking them to repeat those silly words back to you a few minutes later.
Okay. All right, so that's like immediately. So what about the rest of that evening? What are things that I should look out for as a parent, or if I was even an athlete, what should I have in mind of, I'm not really sure if I sustained an injury related to the head. What are some things we should look into?
Headache pain, neck pain, blurred vision or dizziness, feeling foggy, memory issues, and just feeling off. And,
Okay.
and feeling foggy is a really big one. Most people with concussion will feel foggy. Also being very over emotional or just having emotional dysregulation is a big symptom as well.
We should talk about that more because I feel like those symptoms are, man, I could just say I worked really hard today, or man, I just have a little headache. It's because it was really sunny out, or I have a lot of stress in my life, or I have a lot of homework to do tonight. So I could justify each of those symptoms related to something else because I'm in that gray area. You know, it's not like I hurt my knee hurts, I'm hobbling around the house. Like it's a head injury, and I can justify, this and that and the other. So what would you say to someone who's kind of in that gray area?
And that's what makes concussions so hard to diagnose, is because there is so much gray area, and a lot of people do exactly that. They try to push their symptoms off on something else, partly because they want to get back on the field and play, and partly because it's really hard to recognize those symptoms even in yourself.
So there's the phrase that you had shared with me, and that was, when in doubt, sit it out, right?
Yep.
So just playing devil's advocate, I think that's easier said than done,
Yeah.
right? When in doubt, sit it out. Well, again, I'm going to justify why I have those different symptoms. I'm going to continue to play. So if I make that decision to continue to play, what are the possible ramifications?
So when an athlete or a person sustains a concussion, their brain immediately goes into a metabolic crisis. And if you continue to play at a high level, like any game or activity, you're using a lot of calories then that your brain needs to really heal. and start the healing process. So as soon as you continue playing, you're going to exacerbate that metabolic crisis. And you can actually add 2 weeks of healing time on to your concussion rehab.
Okay, so that would take me out of play for even longer.
Even longer.
So, so you mentioned something really interesting about the behavior adjustments that could be seen. Can you provide some examples on, like, what does that look like?
Especially for a kid, they might be more argumentative. They might be just more emotional in general. Your kid's just not going to be themselves. So, especially if they, maybe the next day when they get home from school, they might be a little bit more crabby, or tearful, or just not their normal emotional state.
Okay. So we talked about, like, on field, there's the quick screen that we can do, maybe what we might recognize later that evening. Let's talk about, like, a third stage of, like, maybe that next day. So we're kind of in that 24 to 36 hour period. What are some things that we should start doing if we're not sure and we're actually being smart, understanding the education that's around concussion, and we're trying to be proactive about it? We're in the gray area. We're not sure if there's a concussion, there's not. What should we do?
You probably want to you could give us a call, you could give another medical provider a call. But we probably, if you're not sure, it's probably best to get checked out.
Okay.
By a medical professional.
Yep. And when we were putting this together, we had actually looked up Cleveland Clinic and also UH. They both have virtual visits that you could attend next day. So that you can get set up right away. Mm-hmm. And you are making yourself available too to jump on the phone, just ask questions. It's just a discussion to talk about. Here's questions you should be asking your athlete, or if you are the athlete, here's questions that you should be considering and things to look out for. Let's say that the questions are leaning towards more on that erring on the side of caution, mm-hmm. and something needs to be done. The next step then would be to get into the doctor.
Correct.
Have a confirmed diagnosis, mm-hmm. of concussion, so then you can start the process of the treatment.
Correct.
What the heck does treatment look like for that?
So we have to assess where the person is, what symptoms they're having. So are they having visual disturbances? Are they having memory problems? Are they having balance problems? And with concussion, we have to work on reintegrating those systems in order to heal.
Okay. And then let's say those systems have been identified. Is that an ENT that takes care of that? Is it the doctor that takes care of that? Is it yourself that takes care of that?
It can often be a multidisciplinary team that works on that. So certain visual symptoms need to be seen by an ophthalmologist. It might be the ENT that works with some things. It could be PT and OT, and it just depends on where the person is feeling their symptoms and what triggers them to continue to have symptoms. But PT is often a very, very big part of that.
Okay, very good. So the process then, get established with the doctor, have that diagnosis, and start that treatment process. Mm-hmm. That's where, even within, like, my knowledgeable background and yours as well, treating the concussion athlete very similar to, like, a whiplash injury, right? Establishing what systems are off, let's retrain those systems, get them back on track. What's the time frame look like for that?
It can be a very mild concussion, can be a few days. Anything over a month is then getting into the realm of, like, a chronic or post-concussion syndrome. So usually between 2 and 4 weeks is pretty average for most people.
Okay, very good. And again, that's probably determined after that initial assessment, seeing how well that progress is going.
Yes.
But yeah, this was really helpful. When going through this process with you, I had learned a lot. I probably would rely on Dr. Google. What did Google say? Concussion, what are the symptoms? And then I could probably just, like, justify all those different symptoms to something else. Mm-hmm. But if it was going to be my child, I just would want someone in person to take a look at them to understand, like, what is actually going on, what's the best course of action for them. So I'm glad that you're able to share your knowledge, your information, and I hope the folks out there If they're in that stage of maybe something did or didn't happen, they know that they can reach out to you immediately, talk about it. What about a preventative measure? Because is that even a thing? Can you prevent concussions?
Well, you definitely want to wear the right helmet for your sport and make sure it's, in good condition. Not all sports have helmets, but if your sport does have a helmet, like if you're riding, you should have a helmet on. If you're on the ice, you should have a helmet on. If you're playing football, you should be wearing your helmet. But also, you can do a pre-screen before the season for athletes that are over the age of 12, and that's called an impact test. Is probably the easiest one to do. You can do it on the computer. It costs like $35. You don't have to go anywhere fancy. You can just take it at home.
Okay. And what would that pre-screen provide information or value? Like what does that do for your